Hello viewers, welcome to the Lungleng show. I have been doing series of episodes on health, and partly I felt that this is important and educational. There are so many things we can learn from health specialists. And today I have one specialist who is a urology specialist, a urologist by the name Dr. Joy Narayan Chakraborty. And he is a practicing urologist specialist even at the Apollo Hospital XL in Guwahati. He is also a visiting faculty at Edinburgh University at the Center Surgical and Urological Center in Edinburgh University. And he has worked as a doctor. He has practiced medicines in urology as a urologist for the last 30 years. I think the amount of experience and expertise that he has gained from this will be quite insightful. And as human beings who have body, we all suffer from kidney problems and all these issues. Which we will come to that later. And this is going to be very important. So please tune in and let's have a very wonderful conversation with our specialist today. So Dr. Chakraborty, thank you so much.
Hi.
For coming to our show and have this conversation.
Thank you, Lungleng. Good afternoon, and giving me the opportunity to talk about some urological issues, which everyday people are so much think about and anxious about: stone disease, prostate disease, and all these things in our society, and which is getting increased day by day.
Correct.
So today, we focus chiefly on this stone issue.
Kidney stone especially,
especially.
So before we begin that, can you please briefly tell me where did you do your studies and when and how you became a doctor?
I am a senior person in surgical faculty, and I passed out in 1996 from Guwahati Medical College. After that, all my studies are from outside in Calcutta, Delhi, and then I used to work at Max Hospital. Then I have urological exposure in UK for several years, and I am the recipient of FRCS Edinburgh Fellowship of the Royal College of Surgeons of Edinburgh, RCS Royal College of Surgeons England, so FRCS England also, and then recently I got the Glasgow also, and then FRCS in super specialty, that is urology, and presently also I am a visiting faculty of Edinburgh University in surgical and urological sciences, and at the same time I continue as a researcher in IIT Guwahati, and my work, the theme of my work is on the prostatic implants. So biomedical departments, it's under mechanical engineering department, IIT. I am a PhD student in IIT at present.
Oh, at present.
At present also, and for my research purpose. And previously I used to work at Max Hospital at Delhi. After that at Apollo Hospital for Guwahati for many years. After that Fortis Hospital also, Calcutta. Fortis Hospital. And now I am doing my work specially in urology, prostate and stone disease, and as a comprehensive center and backup in Guwahati Urology Center in Christianbasti. Anybody can Google it, Guwahati Urology Center, and it's a comprehensive center just giving advice for stone, prostate, and all other urological issues. And
that's your own center. That's your own clinic.
That's my own clinic, and that's a center. Almost has a facility of flexible ureteroscopy, flexible cystoscopy, urodynamics, and all these higher strata tests which are necessary on day-to-day basis in urology.
So, having worked as a specialist, having studied at top universities, one of the best universities, and even received fellowships from very well-known and reputed organizations in the field of urology and relate all the surgical studies and so on, related to this. I want to know. See, we all are a victim of a kidney stone in one way or the other. What is that kidney stone? Where does it come from?
Yeah, you are very right, because most of the people, they have got some confused confused notion about what is stone, and some people came to me with gallstone also. So in gallbladder stone, I want to stress on this fact that gallbladder stones are completely different. These are related to liver and gallbladder. Kidney stones is different. We have two kidneys. We need to know that the little bit of anatomy of the kidney, that every person has got two kidneys, and there are kidney, and then one tube is coming from the kidney, and that it joins the urinary bladder. So from kidney, the urine will pour directly into the bladder, and the bladder works as a storage organ. And when we feel like peeing and sensation that I need to go somewhere and release my bladder, then we started peeing. So this is in a nutshell the whole urogenital system. Kidney, ureter, bladder, and then the passing, that is called the urethra or water pipe in layman language. So kidney also has got several rooms. Suppose if we take our flat or our home, first we go through a road and then enter our drawing room, and from drawing room there are 3 or 4 bedrooms. So in drawing room we sit. In bedrooms there is only one entrance to every bedroom. Suppose 3 or 4 bedrooms, one drawing room, and from drawing room there is an exit, a narrow path, and goes to the more bigger street. So in kidney also, the smaller rooms, these are called calyx. So bedrooms, we can like it just like it is the bedrooms. From bedrooms, the urine comes to the drawing room, and from drawing room there is an exit through a narrow exit, that is called the ureter. And from ureter it comes the urine and stores in the bladder. So stone, first of all, it starts in the calyx, that means in the rooms. So it is not blocking the drawing room, it is in the bedroom. So stone first starts forming in the bedroom. Then once the stone gets detached from the bedroom by somehow, or it becomes large, it comes and then start falling into the drawing room. And if the stone is large enough, then it will not exit the drawing room door, then it will grow in size in the drawing room. And that is called the pelvic stone, renal pelvic stone. And but if the stone is small enough and get by exit through the door of the drawing room and comes in the street, small street, that is called ureter. It is called ureteric stone, and this is the problem when it comes to the ureter. That means that there is a narrow passage. Narrow pipe. And if the stone gets stuck in the pipe, then the patient starts screaming with pain. And at that time, we call it ureteric colic. And there will be severe pain, vomiting, and the patient needs to take some emergency medical care, go to the hospital and take injections.
So before it reaches the pipe, we don't feel the pain, right?
We don't feel the
Only
pain.
when it gets stuck in the pipe, we feel the pain.
Yes.
Wow. So what is that stone made of? Is it the real stone, or is it made of chemical, or?
It's a real stone, but it's not unlike, it's not the granite or marble. It's something, the composition is, most of the times it's the oxalate stone. Sometimes it becomes phosphate, triple phosphate stone, calcium oxalate phosphate stone, and in 5 to 10% cases it is uric acid stones. But in most of the cases it is just oxalate stone or phosphate stone.
I see. Once I had a situation where my stomach started paining, and I realized with the doctor told me that after doing the test, they told me that it's a kidney stone which is stuck in the pipe, and I have faced that experience. It's extremely painful.
It's extremely, you are right, very right in saying. So I need to talk to your viewers that once you have a pain, not to worry about and not to be panic. It is ureteric colic, and there might be a small stone. Now the problem is that whenever you go to a hospital or any clinical center, initially the doctor will give you symptomatic relief. Symptomatic relief means
Right.
we need to give some injection, we need to give some antacids, and with that, usually the pain subsides within half an hour or 1 hour. But there is, if the stone is stuck in the ureter, there is no guarantee that the stone will not come up again later in the day, or after a few days, or after 1 day also. So, initial investigation as an, we need to do some tests, some blood tests, a little bit,
Oh.
and we need to do one ultrasound. Now, the problem is that ultrasound will detect indirect signs mostly. Most of the ultrasound, if the stone is in the kidney and large enough, then only ultrasound will pick it up.
Okay.
But if it is in the ureter, that means small narrow tube,
Right.
ultrasound most of the time fails to detect any stone.
Why is that?
But the patient is still having pain.
Exactly.
So, in case of stone, always we need to do, after the initial phase, that means he is being treated for pain and all this vomiting, our first investigation of choice is a non-contrast CT. Without giving dye or contrast, we need to do a plain CT. That is called non-contrast CT. CT is a sure shot method.
Okay.
Almost it is 100% sensitive and specific also to detect how many stones, what is the size of the stone, how much density the stone is have, and where it is located. So, CT scan is must, but non-contrast CT, not contrast CT.
Okay.
Without giving injection, it can be done within 10 minutes.
So that's the safest way to get
That
the
is the
treatment,
safest
right?
way to get treatment. First, ultrasound, but ultrasound is not 100% sensitive.
Okay.
And second, we need to do a non-contrast CT. If not the same day, the next day we must get a non-contrast CT done.
Right. So if I have like excruciating pain because of the kidney stones,
Sure.
I should I ask the doctor to do CT scan, or
Yeah.
should I be happy with the ultrasound?
No. We must ask the doctor that if you don't have the facility here, just refer me somewhere. Doctor, nowadays all urologists, they do as a standard procedure, we ask the patient to do a non-contrast or plain CT.
Okay.
And then it's not a contrast injection or something like that. It can be done within 10 minutes. And the patient also can understand by seeing the, looking at the CT scan plate, where my stone is and how big it is and what is the density of the stone. Because it tells us many things, the CT scan. What is the chance of that stone getting out on its own, whether that stone needs to be treated surgically or not, whether the stone will cause any problem to my kidney or damage my kidney. So many of the answers we get from the CT scan. So CT scan is not only for diagnosis, it's a plan also for what to do with the stone. If the stone is small enough, suppose 6 or 7 millimeters stuck in the ureter, then we ask the patient just wait. This stone is not going to damage your kidney. Wait for 10 or 12 days or 3 weeks. By that time, the kidney will not get damaged, and there is a chance that the 6 or 7 millimeter stone, 80% chance of getting out or flushed out on its own. But one thing I need to stress here is that there is no medicine on earth to dissolve a stone or to get the stone out.
Okay.
So there is no medicine. But some people, they are writing that potassium citrate, there are some bottles available in the market. These citrate, these things, these will not dissolve stone anyway. And we don't need to believe all these things. These are a little bit of confusing things. If the stone gets out on its own, we should must thanks the stone itself. Not to the doctor, not to the stone. To get out, and many thanks to you. And second, the phase we come is the prevention. How to prevent it?
Okay, exactly. I just want to know. Now, see, you have a CT scan done. What are the different sizes that you determine? Because like my size seems to be very small, so there was no need for surgery. And you have been doing surgery for this as well. So you do the surgery, you cut open the pipe, or how does that work before you jump into prevention?
So we need to see first I've already told you that we need to see the CT scan plate.
Yes, imagine that the stone is big.
If the stone is big enough, suppose there is a stone in the kidney, it has not come down to the ureter.
Okay.
If the stone is less than 2 centimeters, then we go through the urine pipe, the natural urine pipe.
Correct.
via the urethra,
Right.
natural passage,
Yeah.
and then reach the kidney by a flexible ureteroscope and use laser to break the stone into dust. So this is the way. If the stone is more than 3 centimeter, more than 4 centimeter big stone, then we must do a PCNL, percutaneous nephrolithotripsy, which commonly people know as keyhole surgery. That means we have to put a hole inside the kidney, break the stone, and take the stones bit by bit and clear the kidney. So this is the large. But however, if a stone is small enough, 7 millimeter, 6 millimeter, and stuck in the ureter, we tell the patient, so see, you don't have any fever, there is no pain, or beach mein there is something, some pain may be there, and he can go and take one injection, lie down in the center for 1 or 2 hours, and then come back and then normal food. It is nothing to do, but painkiller is the only thing we can advise. This stone has got a 80 to 90% chance of getting out. But if a stone gets stuck in the ureter, that means the passage,
Correct.
more than 8 millimeter,
Yeah.
and it stays there for 2 weeks or 3 weeks, it is not moving. But sometimes there is pain, 3 or 4 injections patient needs to be taken in a day. Then we ask the patient that it is better to get the stone removed. But there is no overnight indication that I must get the stone out now only, otherwise the kidney will get damaged. This is not the scenario in any case.
Okay.
You can take time, wait, take the painkiller injection,
Acha.
and see whether the stone gets out or not within 2 to 3 weeks. If 2 to 3 weeks is okay, you don't have any fever, there is mild pain which can be tackled with oral painkillers, then and antacids, then wait for, it is better to wait for 2 to 3 weeks.
Wow.
6 to 7 millimeter stone, they gets out on its own.
Correct.
Again, I am telling that there is no role of any stone dissolved medicines or stone clearing medicines. There is nothing on earth like that, and we should not take this and that and this, the herbals and all these things.
Okay.
So this will ultimately get the kidney more damaged than when the stone gets removed, it get spontaneously removed on its own.
Wow. So like kidney is very, very important part of our organs of our body.
Yeah.
And in order to protect the kidney from forming any other diseases, let's say, and also these kidney stones,
Yeah.
tell me some of the best practices to prevent issues like this.
See, our kidney is the scavenger of our body.
Correct.
By telling that, I must say that it removes all the bad elements of our
Right.
blood. Whatever we take by mouth, it goes into our blood. And who get the scavenging work of the blood, that means filters the blood, it is the kidneys, both our kidneys. So we need to see that we don't take so much of protein load.
I see.
Number one. Too much protein, that means specifically I need to say that the red meat is bad for the kidney. So too much indulgence on red meat and then fried foods.
Wow.
And all this high protein diet, and nowadays
protein
lots
powders.
of gym. I
Yeah,
see
yeah.
that there is a protein.
Correct.
Yeah, these things. Sometimes many people come to
Yeah,
us. Suddenly there is a rise in creatinine level and kidney function test is dropping.
Achha.
So we ask what you are taking. Well, I am taking all these protein supplements for long time. So these things are bad and these damage the kidney. There is a chance. So this is another new thing I think we have heard first from my side. But many nephrologists are getting such type of patients nowadays.
What is nephrologist? Oh, sorry.
Nephrologists, yeah. Now there is a question. Nephrologists means those doctors or specialists who deal with the medicine side of the kidney.
I see. Not the
And
surgical
not
side.
the surgical side. Suppose stone, prostate infection, these things are tackle prostate cancer, kidney cancer, these things, surgical aspects are tackled by the urologist. Whereas, if the kidney is getting bad, nephrotic syndrome, the creatinine is going up, patient is having diabetes or hypertension for long time, and suppose you see the kidney is getting bad day by day, it is the work of the nephrologists. So the dialysis and all these things, transplant, this goes to the nephrologist side. And the surgical aspects goes to ours, that is the urology.
Correct. So as a young person now, there are a lot of viewers like who are of my age, okay, from on this platform. You know, we see that there are a lot of people suffering from kidney problem, and when you have a kidney issue, the whole body becomes a problem, right? Kidney is a very important function of our body. I mean, very important part of our body, because, like you said, it purifies our blood system. It's like a scavenger, or scavenging organs that purifies a lot of stuff, that eats the impure part and just removes toxins and so on. Can you suggest us, some lifestyle practices that you should do this other than your diet? Do you have lifestyle suggestion like for people?
Yeah, see, there is a socio-economic changes all over the world. It's not that in Northeast or India it's going on all over the world, and many food chains are coming here and there. They are mushrooming like anything, and there are some Zomato, Swiggy type of things also. You can easily accessibility to the fried foods, to the type of foods which our kidney don't like.
Achha.
So it is better to avoid red meat. Sometimes you get, but overindulgence in red meat is bad thing. But once need to take into account the social practice also in a state. So overall, I need to say that more water intake, less fried foods, and less indulgence on the red meat, that's high fiber, and over protein, this protein supplements. So if we can avoid all these things, the kidney remains good. Another thing is that these things, whatever foods I have already spoken to you, these foods are also responsible for our lifestyle diseases. Our lifestyle diseases are our diabetes, blood pressure. So these things are also related more on the type of foods we take day to day. Wow. So if we avoid all these bad type of foods and less indulgence, our kidney remains good. Fruit juice is good for the kidney.
Okay. Yeah. So for prevention, I think those are very, very important.
They're very, very important.
Now suppose prevention, I haven't got any, for example, kidney issues, so fine. But now suppose for those who have got kidney problems, what are the ways of treatment that you normally do? Treatment as in like when somebody has a kidney stone or kidney problem, not necessarily only the stones, but it could be any other problems. How do you treat kidneys normally, kidney issue?
The best way of putting, kidney has two types of problem. One is medical renal disease, medical kidney disease. One is surgical kidney disease.
Right.
If the surgical kidney disease, then the urologist will take over. If there is stone or something else or any block, then the urologists like me will take care of that. If the kidney is getting bad due to some systemic disorder by things are comorbid diseases like diabetes and hypertension. These are the two main things which make the kidney bad. As age advances, so we need to take care of those diseases, blood pressure and sugar. One thing I must tell to your viewers, that once the kidney is getting bad, suppose the person is 60 years or 65 years, and the kidney, we need to see not only the creatinine, we need to see the GFR also, glomerular filtration rate. If the glomerular filtration rate and the creatinine are on the rising side, GFR decreasing and creatinine is rising, medicine cannot help. But there are many medicines in the market. More of the medicines are like food supplements. So people take on this on good faith that these medicines will make our kidney good. But once the kidney has lost some part of its function, it is irreversible.
I see.
It is irreversible. Suppose the person is having 100% kidney function, he has suddenly lost 30% of its kidney function and it is working 70%. So there is no way that the 30% can be reverted back with medicine.
Wow.
So that is lost means lost.
You have to take care of it.
That 60 or 70% of the function, whatever left, we have to sustain that over time.
You cannot reach 100%.
With 100%, never.
Okay.
So by taking all these, there are many medicines. These are food supplements. I've already told that people are now prescribing more food supplements than medicines. So the main thing is that to control your BP, blood pressure, sugar, and any other treatments you are taking to keep your kidney in a healthy state. Our aim is to put the kidney function at a sustained level.
Correct. Well, that's
so that it is not a nose dip.
Correct.
Just like our Ahmedabad accident.
Yeah. It should go.
It should fly.
It should fly at the same rate.
Our lifetime, our lifestyle.
Right.
That will make our kidney to fly at a such level.
That's true. Have you seen a real human kidney? I mean, you must have because you're a surgeon.
Yeah, on daily basis.
Right.
Yeah, almost on daily basis.
How does kidney clean itself then? Kidney is the one cleaning our body. Then how does it clean itself?
Yeah,
Normally, like
this again comes into the microcirculation. The kidney is a very, very vascular
but
organ.
it's an
in the
amazing
body.
organ, right?
Amazing organ.
Yeah.
The 1 to 2 liters of our blood is getting filtered by the kidney every minute.
Every minute.
Every minute.
So it
1
keeps
to 2
pumping
liters
water.
of pumping.
Wow.
Heart is pumping 1 to 2 liters of blood into the kidney to get the blood washed out, cleaned out.
How beautiful is that?
Okay, and there are multiple sieve. It's a net-like.
Yeah.
And multiple blood vessels. And then it is the main organ is called glomerulus. Everybody know, I think by this time, it is called glomerulus. There are multiple millions of 1 million glomeruli in every kidney. That means the sieving part.
Correct.
Filtering part. Wow. This is the main filtering organ is called glomerulus. The kidney filters the blood, bad blood, and put the good blood into the system again. It's
So
like that.
roughly, do you remember how many kidney surgery related to kidney you have done around?
So by this time, I have done more than 12,000 kidney surgeries right now throughout these years.
Yeah, I think you are an expert in that. So
yeah,
it's wonderful
so
too.
it's more than 12,000.
Yeah. So last question: what is one symptom that commonly happens when you have a kidney problem? What is one symptom so that?
See, most of the people, they don't know that they have a stone.
Okay.
Once you come to the doctor asks, please you are having some discomfort on the right side, get on ultrasound. Pain on the right side, discomfort on the right side, the ultrasound will detect an asymptomatic stone on the left side. And the patient gets worried that I have a stone on the left side. And then you do CT scan, 6 mm, 7 mm stone on both the kidneys.
Okay. Wow.
These stones, if these are in the kidney, not causing any problem, and the limit of the stone is 7 or 8 millimeter, no treatment is necessary. Just remember this, no treatment is necessary.
Which
just
millimeter? 2 millimeter.
Up to 7 millimeter or 8 millimeter. If they are sitting in the kidney, not coming in the passage and not causing any blockage, no pain, no treatment is necessary.
Okay.
Just take preventive aspects, so more water.
Okay.
Someday these small kidneys will come and get washed away.
I see.
Sometimes people don't understand also.
Wonderful.
Another point I want to stress here is that when a person has got a kidney stone, there is a chance that in another 5 years, he might have a second incidence of kidney stone. That means removing a kidney stone does not guarantee that another stone will form in another 5 years.
That's correct.
Removing and picking up and doing surgery for all the stones, it's a futile attempt.
Achha.
So we need to understand this and not to be panic. We control our food habit.
Drink a lot of water.
And more of water.
Correct.
And wait and watch. And get ultrasound done every 6 months.
Oh, really?
Not CT, every 6 months for people who have ultrasound, not for general public.
Okay.
Ultrasound.
Right.
But I want to say another thing. Those people who have their kidney stone as well as pain, they are lucky in one aspect that they get detected. They are having pain.
True.
They know that I have to do a CT scan and I have a stone stuck here. They are more lucky. But there are some unlucky people also. Only the percentage is low. Their stone grows without their knowledge. Suppose once pain is there in a village, painkiller he has taken and then pain has gone. 1 or 2 days painkiller, pain has gone. He thinks that everything is okay. After 10 years or 12 years down the lane, he will come with a very big blown up kidney. By this time it's too late. So these people are really unfortunate. So one thing, kidney with pain is a good thing. That's a wrapping up statement.
Makes sense. Wonderful. This has been a very wonderful conversation and very educational on its part as well. I'm sure it personally educates me a lot. Thanks for sharing your knowledge,
Thank
Doctor.
you.
Yeah. Nice to have you.
Thanks.